Hi, I'm Genia. I am a Nevada State College nursing student, and I'm going to be with Mitzi Flores, and I am going to be looking over my provider's orders today. So I will be looking over the orders, following his care plan, and following standard precautions. Right I'm doing now is getting my medications from my doctor. I have my patient, his name is Clark Kent. He is born on June 18, 1958, and he has no known drug allergies. He has a prescription for a 0.9% sodium chloride, or regular normal saline bag, and 250 mils. And also he has an antibiotic because my patient has appendicitis. So he is going to be taking the antibiotic, and it's called Zosyn. It's 3.375 milligrams or grams, and I need to get that out of my Pyxis. So now that I've looked over my patient's information, I'm going to be logging in, and I'm getting all my medications. Okay, so I have made sure that my medication is not expired, and that it is the right medication and the right dose for the right patient. Okay, so then when I'm done with that, I close up, and I'm going to go ahead, and that was my first check. I'm going to get my supplies. So now that I'm getting my supplies, my patient is going to need a J-loop here. That's an extender. And I'm going to need an IV kit, which comes with tape, and the ChlorPrep, the gauze 2x2s, a tourniquet, and some alcohol or some iodine, and also Tegaderm to tape onto my patient. Okay? Then I have my saline syringes. I've got 2. Okay? And then I have my primary tubing, which is my Alaris pump, and I have my secondary tubing. Okay, so I have all my supplies, and I'm going to be going into my patient's room. But first I want to talk about what gauges I would pick for my patient. Okay, my patient is Clark Kent. He's Superman. He's 60 years old now, but he still has a great body shape, and he's not obese or anything like that. So a standard gauge needle that I would use for him would probably be about a 20. I could do a 20 or a 22. So I'm going to go with a 20 today. Anything lower than that, like 14 to 18, would be great for emergency situations if I need to do a blood transfusion, or if I need to do a contrast dye or some kind of oil-based thick medications. I would go with the smaller gauge. Okay, now they go up to 24 gauge, and that would be used for a newborn. Okay, so today I'm going to go ahead and do the 22 gauge for Clark Kent. So I am gathering all my equipment, and I've got my provider's orders. Okay. So for the purposes of this exam, I'm going to be using a human arm for a moment, and then I'll come back here, okay? So first I'm going to look over my provider's orders, plan of care, standard precautions, knocking at the door.
Hello.
Hi, I'm Genia. I'm a Nevada State student college, from Nevada State College student, and I'm here with my professor, Mitzi Flores. How are you doing today?
Good, thank you.
Good. I will be performing hand hygiene. Okay, and I'll provide some privacy for us. First thing I want to do is make sure that I have the right patient. So could you please state your first and last name?
Clark Kent,
And then your birth date?
June 18th, 1958.
And do you have any allergies, Mr.
No,
Kent?
I don't.
Okay, is it okay if I call you Clark?
Yes, please.
Okay, great. May I pull up a chair? I'd like to educate you on
Go
what's
ahead.
happening today. Okay, all right. So you do have appendicitis. The doctor has prescribed a saline bag for you, and also an antibiotic, okay?
Yes.
This is going to be an IV, all right? So an IV is an intravenous medication. It's going to go in your vein. Have you ever had
Okay.
that before?
No, never.
Okay, so I don't think you'll probably be afraid because you're Superman, but what I'm going to have to do is you can choose an arm, your right or your left.
All right, it's fine.
Right, okay, and so I'm going to be finding a vein for you, and this procedure won't take very long, but first it's very important for me to make sure that I find the right vein, okay?
Yes.
Okay, so I'm going to apply my tourniquet nice and tight. Okay? Okay? And I'm assessing for the vein. Okay? So what I'm going to do is I'm looking here and I see that Mr. Kent has great veins. And I'm looking here and I see the cephalic vein is a good one, and I'm going to choose that one. So what I would do is maybe use the back of a pen or something and mark that. And so I can see the dent on my patient so that when I take the tourniquet off, I'll still have that little dot there where I can know where to go in. Okay, so now that I'm done with this human person, I'm going to go over here. Okay. Hand hygiene. And I'm going to go ahead and put on gloves. Okay, I have all my equipment here. I got 2 of everything because just in case I would mess up, I would want to make sure that I start at the distal area of the body and move up. That way, if I blow a vein or something, I would be able to go up. So I have 2 of everything, okay? So first thing I want to do is take out my J-loop, and I'm going to take out my syringe, okay? I'm going to put them right here for a moment, and I'm going to get my tape ready. Now, ideally, it'd be nice to put the tape on my gloves. Okay, I have it on my gloves, and that way it stays where I need it. Okay, I'd like to get some extra, but I can't find this. There we go. Some extra tape, just in case. Okay, dispose of this glove. That would be hand hygiene, putting on another glove. Okay, I want to connect my tubing. So the first thing I'm going to do is take off these caps. Okay, now this is sterile, so I don't want to touch anything. This, I'm going to prime this, get this out a little bit, and I'm going to connect here. Okay, and I'm going to take this, unclamp, and make sure that I get all of the air bubbles out. Okay, that's good. Clamp it, put it back in here. It's ready to go. Okay. Now, I have my supplies that I need. I'm going to take my tourniquet here, and I'm going to put it back on my patient. Remember, I had a little spot on my patient's arm, and I'm going to tie the tourniquet here, again, nice and tight. Now, I'm going to take my ChlorPrep. This is a great thing because it's mixed with alcohol and chlorhexidine. And I would use that in a circular motion starting from the center and working my way out for 30 seconds. Okay? Now I must wait for that to dry. Okay, and now that it's dry, I'm going to be ready to clean my patient's arm. I already cleaned my patient's arm. So now I'm going to be ready to put the IV into the patient, okay? So I'm going to go in between a 10 and 30 degree angle with the bevel up. I'm going in. I see a little flash of blood, which is great. So I'm going to advance a little bit more, like another millimeter, and it's going in now. I'm going to advance, and then I can go ahead and push the safety button, and it'll take this away. So now I have this connected, and I'm going to go ahead and do some taping. This is my Tegaderm. I'm going to tape it down. Okay? And then I would make sure that I initial the time and the date. Okay? I'm also going to apply a piece of tape here underneath to give it a little, there we go, to raise it up a little bit. Okay? So that's good. Now I can let go of the tourniquet off, and I can flush. Okay? Connecting. I can let go here so the blood will be free to go. Connected this. Okay, now what I need to do is I need to flush. Okay? So I am opening up the clamp, and I might see a little blood coming back, which is fine, which is actually good. And then I'm going to push 2 to 3 milliliters. Okay? All right, so I'm doing that. Okay. Now I need to tape this here. Tape. And I've labeled it. I did my initials and I did my labeling here. And I've got it taped down to my patient. Okay. So now what I want to do is take, how are you doing, Mr. Kent? Everything okay?
Yes.
All right, so what I need to do before I do this is I need to educate you, okay? So what we're going to look out for is infiltration and infection. So with the antibiotics, like the saline will be given to you because you're dehydrated. That's going to help with your fluids, but we want to make sure that you have no puffiness around that area, or if it feels cool or strange. Also, if you have redness, okay? With the antibiotics I'm going to give you, that can cause a seizure, and it can also give you diarrhea because it's an antibiotic. So I would like for you to know if you have diarrhea, because it's going to take away all the good and the bad flora. And also a big thing with antibiotics is rash. And so what you want to do is make sure that you call me if you have any problems with that. Okay. So now that that's taken care of. Okay, we're going to go ahead and take the saline. We're going to now hang our saline, okay? So this is our saline bag. And I'm going to take my primary Alaris pump. And what I need to do is make sure that I have no kinks in this pump, and that everything is straight. I don't want to drop anything on the floor. Okay. And I would make sure that it is clamped for the moment. Okay. So okay, I would take my alcohol swab, and I would make sure that I clean this area here, and that I'm going to take this off. This is going to spike. This is sterile, so I want to make sure I not touch it. Connect it. Okay, so now this is connected, and this is all intact. It's clamped. And I'm going to unclamp, and I'm going to go ahead and prime it. Okay, so I'm going to unclamp everything and let it run. I see some drips here, so it's good. Now these extra ports, I could do a Dura cap, which is a antiseptic cap that will go to cover the ports that I won't be needing. Okay, so now I'm going to take my alcohol, and I'm going to connect this. Cleaning this. Okay, this is all attached and clean, okay? So I'm going to fill this up. I'm going to make sure that everything has been disposed of in the proper receptacle, including the needle, okay? I've made sure that I feel that the patient is comfortable and that he has no sensation of pain or anything like that, okay? So now, Mr. Kent, how are you doing?
Good.
Okay, good. So I have this filled up, and I would start this, the flow on this, okay? I would be opening up all my clamps. And it's important for me to label. So I would be putting a label here. It's a good place to put it right here so that people can see it, so you know when you actually started this IV, who started it, when they started it. That way we know when to take it to get rid of it. Okay, so now that's working. And I'm going to go open up the clamps and let the sodium chloride, the regular infusion, go into the patient. Okay, so the next thing I want to do is attach the piggyback, which is the antibiotics. I have Zosyn, and it's called piperacillin, and it's tazobactam for 250 milliliters per hour. This is an IV piggyback. Now, if I had an IV push, I would go ahead and use this port here to put in the IV push. I would be cleaning, I would be flushing, I would be putting in the medication, and then I would be making sure to clean again and close that up. But I'm doing a piggyback, okay? So with a piggyback, we want this to be higher than our primary. Okay, so I've got this higher up, same thing. And now I need my secondary tubing. And the same thing, I'm going to take the lid off. I'm throwing away everything in the proper receptacle. And I'm going to spike. This is sterile. I'm going to spike. And it's going to go in. Same thing with this. I'm going to label. So I have the time, the date, the person, which is me, and the medication at the rate that it's going to be going in. Okay. I need to prime this. Now with the machine, I could do, back flow it, but I could also prime it by hand by unclamping, squeezing, letting just a few drops out. We want to always save our antibiotics. We don't want to waste it. Okay. I've had my first check at the MAR. I've had my second check with my prep. And I'm doing my third check here with my patient. He's the right patient, the right time, the right medication, the right dose, the right route, all that good stuff, okay? So now, alcohol. I'm removing my, my cure cap here. I am cleaning, making sure everything is really clean. And I'm going to go ahead and attach without touching my secondary to my primary, okay? Now this is going to be flowing into the patient. When this is done, then this will take over. Okay, so we have everything cleaned up. Now, Mr. Clark Kent, we want to make sure that you please report any kind of pain, any kind of inflammation, any kind of leakage, any kind of bruising, itching, anything like that. It's very important that we always monitor our patient. Now, because this is antibiotics, I will be making sure that I come back to my patient within 15 minutes because it's very important to make sure he doesn't have a very severe rash. Steven Johnson is very dangerous. Okay, so I'm going to take my gloves off and I'm going to perform hand hygiene. Mr. Clark Kent, do you have any questions? Do you have any questions?
No, I'm okay.
Okay. Hand hygiene, I'm going to go ahead and lower the bed to the lowest possible position. I'm going to raise the rails, and I'm going to provide my call light for my patient, Mr. Clark Kent, okay? If you don't have any questions, I'll be returning within 50, I'll be waiting here and making sure that everything's okay. But once I do my rounds, I'll make sure to watch out for the call light, okay?
Okay.
So then I'll be leaving the room. Thank you very much. Cleaned my hands, did all that. And then I'm coming back. This is a few days later. The doctor has now asked me to remove all of the IV tubings. So I'm verifying provider's orders, plan of care. I will be following standard precautions. I am knocking on the door.
Hello.
And I am, hello, providing privacy. And I am performing hand hygiene. And what I want to do now is make sure that I talk to my patient. Mr. Clark Kent, how are you today?
Good, thank you.
Good. May I please make sure that I have the right patient? Can you give me your first and last name?
Clark Kent,
And then your birthday?
June 18th, 1958.
Okay. And do you have any allergies, Mr. Kent?
No, I don't.
Wonderful. Okay, so you're doing okay today?
Yes, wonderful.
Okay, great. Well, I'm back because the doctor has asked me to take out your IV, okay?
Yes.
So you haven't had any issues with this and you're feeling a lot better. This is a great thing.
Yes.
Good. Okay, so the first thing that I'm going to be doing after I did the hand hygiene, I'm going to put on gloves again. And I want to make sure that I look over my IV site. I want to make sure that I assess everything and make sure that I see no issues. And this all looks really good. There's no evidence of any skin breakdown. There's no evidence of any bruising or anything like that. Okay, Mr. Kent, so what we need to do is use our second syringe here. This is normal saline, okay? And I'm going to take my alcohol swab. I'm going to use that 2x2 because there may be some bleeding. I'm going to make sure that I clean. Okay, first thing I want to do is turn off my machines, clamp everything up, and stop the flow, okay? Then I want to clean the area here, okay? And I can take this off. And I'm going to flush. Okay, so what I'm doing is now I'm flushing. I'm going to draw back, and I'm going to flush 2 to 3 milliliters of normal saline. All nice and clean. Everything is clean here. Recap. I'm going to put my finger here on the vein because there may be some bleeding. We're going to take the tape off. All tape. Okay. Tape is now off. Disposing of everything. Okay, Mr. Kent, I'm going to go ahead and on the count of 3, I'm just going to take this out. Are you ready?
Yeah.
1, 2, 3. Okay, so now I have my hand here, my finger, and I'm going to go ahead and put gauze there to make sure that I don't have any bleeding, okay? So I'm looking over at my cannula. I'm making sure that there is nothing wrong with my cannula, and we don't want any part of the cannula to break off into the vein, all right? So it hasn't done that, and I'm good. If it did, I would make sure that I call for help, call the provider, put the patient on the left side because we don't want an embolism, okay? So now that this is all clean, I would give him a little Band-Aid. Put the Band-Aid on. And if you don't have any questions, I'll take off my gloves. I'll dispose of all of my equipment, make sure that everything is clean. Okay, and I hope you feel better. Get rid of all this. I'm going to lower the bed. I'm going to raise the rails. Again, I'm going to provide the call light. And Mr. Kent, thank you for being Superman. I'm going to take off now. Hope you have a great evening. Okay?
Thank you.
Thank you.